When clients are admitted to the hospital, their rights should be carefully explained. To keep personal belongings, to make and receive phone calls, to accept and refuse treatment, to receive confidential treatment, to communicate with people outside the hospital. The rights of a mental health client vary from state to state, so it's important to be familiar with the rights that apply in the state where you practice. Particularly important is informed consent. Consent forms require the signatures of the client and a witness. Consent is necessary for community or hospital treatment, psychotropic medications because of the risk of side effects, and treatments such as electroconvulsive therapy or ECT. Consent for treatment must be obtained even if a client is confused or psychotic. Clients also have the right to individualized treatment and the right to refuse treatment and medications. A guardian may consent to medications when the client is incapable of rational decision-making. If a voluntary client refuses medications, you'll need to consider the criteria for forcing medications. Is she a danger to self or others? Do the medication effects have a reasonable chance of helping the client? And is the client competent enough to evaluate the necessity of treatment? The final right to consider is a client's right to the least restrictive treatment environment. This applies to community and hospital-based programs. The least restrictive setting is treatment in the community. Clients treated in a community setting may voluntarily choose services or be court-mandated to participate. Next, hospital services, again voluntary or court-mandated. Be sure you know the procedure for involuntary commitment in your state. More restrictive is the use of seclusion. As you know, seclusion includes observing a client in a specific treatment area. Before you choose a restrictive intervention such as restraints, first consider whether or not there is adequate rationale documented for the events that led to the need for restraints, plus any options that were considered or attempted. And always be sure there's ongoing evaluation of the client's behavior while in restraints.